Good afternoon, and thanks for joining us for Living Local, your lifestyle show for all things Charleston and beyond. I'm Ashley Meservey. It's Medical Monday at East Cooper Medical Center, and today we're sitting down with a low-country radiologist to learn how advances in technology are helping them see inside the human body like never before.
Medical Monday, sponsored by East Cooper Medical Center.
Joining us today, we have Dr. John Komen. He's a radiologist here at East Cooper Medical Center. Thanks for being with us today.
Thanks for having me.
All right, I got all kinds of stuff to talk to you about. First up, let's talk about what interventional radiology is. I'm like, well,
there are two types of radiologists. There are diagnostic radiologists and interventional radiologists. Radiologists use different imaging procedures to diagnose people. Interventional radiologists use those imaging modalities to diagnose and treat people.
Okay, so do you have to get extra training, or is it just a different tool for you to use?
Well, in the past, radiologists were trained in both diagnostic and interventional, and just over the past 10 years or so, the two specialties have separated. So there are people that do primarily interventional radiology and some that do primarily just diagnostic radiology.
Because they were so different, because they had to address different things, right? They were looking for...
Well, things have become a little more complex, and
he's like, it's not
knowledge
that easy,
has
actually.
grown, and it was just a natural progression where
it's evolved, right?
Yes.
All right, so what kind of procedures fall under interventional radiology?
Well, there are patients that are in need of mammograms. In mammography, we use both X-rays to perform the mammograms. We use ultrasound to try to determine whether things are cystic or solid. And the interventional portion of that, we use ultrasound and stereotactic biopsies to guide needles into the breast to diagnose and biopsy the cancers.
Okay, so let's say 10 years ago, you wouldn't have had this many different ways, right, to treat a patient?
Well, the imaging modalities have evolved over the years. There are we use MR, ultrasound, CT, fluoroscopy, both to diagnose things within bowel. Fluoroscopy is used in the interventional suite to perform angioplasties, to treat people that have dialysis grafts, hundreds of different procedures.
What is one of the most common things that you see coming in here as far as from a radiologist standpoint?
We use CT, ultrasound, to diagnose people that come through the emergency room. That's the most common thing that we do.
Oh, okay.
We treat oncology patients. We can put in implantable ports. We can fix people whose implantable ports have malfunctioned. Dozens and dozens of different procedures.
Talking about radiology from like a broad view, I mean, in the whole process of medicine and throughout this building, like, how does the radiologist fit into the whole deal, you know? It's like a puzzle. I feel like you got the nurse, you got the, all these different people that you have to, that all have a very important role, right?
Well, doctors try to figure out what's going on with the patient, and they can perform physical exams. And when they have questions or they want to actually see inside the body, every physician in the hospital will use imaging to try to help them figure out what's going on with patients. So they were sort of a patient's doctor and a doctor's doctor.
Yeah, I was thinking like doctor's doctor.
They come to us because we know a little bit about each specialty.
Gotcha. All right, well, is there anything else we need to know before we head out today?
Well, no, it's
No?
easier to explain if we look at images and the modalities themselves.
Alrighty, well, I did learn a lot. Interventional radiology. And in one word, can you just explain one more time what that is? Not in one word, but you know what I'm saying.
It is a physician that uses imaging modalities to perform surgical type procedures.
Got it. All right. Well, thank you so much for spending time with us today. And for more information, just head online to eastcoopermedctr.com.